and welcome to another episode of No Age Limit, where we talk about real women and their real stories, as well as uncover why breast health is an important conversation topic no matter how young you are. Today, our guest is not just a breast surgeon, but she's also a friendly face behind Breast Friend Surgery on Instagram. She's known for using her platform to make breast health awareness feel relatable, warm, and even a little more fun. So we are so happy to welcome Dr. Yia Swam with us today.
Yes, hello, and I'm really happy to be here. I am Dr. Yia Swam of Breast Friend Surgery and Wellness. So maybe I give a bit of context. So I am 45 years old, and I've been a breast doctor for maybe about 20 years, right? Starting from the time we are trainees to a junior specialist to a senior specialist, and now having my own practice.
So the first question that I have for you, Dr. Tan, as a breast surgeon, I'm sure you've had a lot of encounters with many different breast cancer patients, right? So if you were to give sort of like a rough gauge as to how many of these patients are young women, what would that number be?
The spectrum of patients have changed a lot in these 20 years. When we were training, we were told breast cancer is for older women, 50 and older. Then after we graduated, it became a bit younger, mid-40s. And right now in my own practice, I see patients as young as, my youngest patient is 19 years old. And then there'll be quite a few in their 20s, in their 30s. So this shift towards younger patients is an international observation. It's just not unique to Singapore only. So just great to have this conversation to raise awareness.
Yeah, I think even in our previous episode when we were talking to another breast cancer survivor, I think we figured that, even at this time, right, there's still a lot of misconceptions about breast cancer being a middle-aged women's disease. And I think that's why we at BCF are also trying to push out the message. Among your patients, do you still get feedback from younger patients who have a hard time reconciling the fact that they are still young and then, having to face this diagnosis?
Yeah. Honestly, I think nobody really expects to get told they have cancer. Right, there's a lot of there's a kind of awareness out there somewhat because of Breast Cancer Awareness Month every year, but to actually be told that yes, the biopsy confirmed you have cancer is always a shock. It's like a slap or a shock of cold water, and the first thought that most is always deny it cannot be me. Right, regardless of age, regardless of risk factors, etc. So for the young ones, I would say, thankfully, I think there's a lot more awareness now among my patients. They come in sort of expecting it.
Oh, okay.
So maybe for my part, maybe in the private sector, where patients who are well educated, well read, social media plays a large part as well. Also, a lot of thanks, a lot of shout out to the young women with cancer going out in public and sharing their stories. So one thing I always joke my patients, right? Good to be aware of these things, but don't self-diagnose and don't make yourself so kanchong and so scared. Yes. That's the other downside of awareness that I see. Yeah. So for the young patients, after getting the diagnosis, that shock, that how can it be me? And then like what's going to happen to me for the rest of my life? I have so many things I haven't done yet. So yeah, all these need to be supported and addressed in that first few visits.
Yeah, actually that was something I wanted to ask, right? Because I would expect that the reactions between the younger women who got diagnosed versus the older women would probably be different simply because of the stages of life that they are at, right? So is there any particular patient's reaction that actually stood out to you at the time of diagnosis?
Oh gosh, this one, the story can go on non-stop. Yeah, so of course, professionally we would want to breach patient confidentiality, right? But there's a few common patterns, can I say common patterns that come out? There are some patients who actually are really very aware. Because nowadays, though, ChatGPT is so popular.
Yeah.
And in fact, on my own post, I always tell people don't Google and don't use ChatGPT. But, women, we are all smart. We'll just Google heart lump 35. Yeah, what could it be? And then list of differentials come out. Then they will, breast cancer. And then they'll click on it and they read more and more. So a lot of them come in almost half fearful. They have already decided they have breast cancer. So in a way, those group may be easier to manage for myself because once I look at the scan, I actually confirm their worst suspicion. Yes, you're right. It is very likely this, but I still need to confirm a biopsy. And if it is, this is what we need to do. I find that maybe for a lot of young women, by having a very clear treatment plan, it helps to calm them down. There is something we can do to get rid of this problem. And I hope that's been helping most of my patients. So that's one group who are sort of expecting it. They still grieve, they're still upset, but they can move on with treatment. And then at 6 months, at 1 year, when they're cancer-free, then that's when we do a lot more discussion about how to accept and move on and lead on a very happy and healthy, fulfilling life. The second group will be those still in a little bit of denial. Felt alarmed, can't be me lah, right? I'm young, I don't smoke, I'm thin, I don't any of the risk factors. Yeah, but I might as well check. And then when they come and say, blah, 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 suspicious, I need to biopsy, I am concerned it could be cancer. So I actually prepare the patients well before that. Then they always, you think so? But I don't think so. That's why I knew it's going to be a hard conversation, because in their minds, they've already profiled themselves as someone who is unlikely to have cancer. So when the black and white report comes out, invasive carcinoma seen, I would tell them, in very simple language, this is cancer. Ductal carcinoma means it's coming from the breast. It's not from other parts spreading to the breast. Then they'll always be, are you sure this is my report? So that denial, I personally find it harder to manage, because they're just resistant. They haven't even, we cannot move on with talk about treatment, because their mind is still, it cannot be me. This cannot be my report. The doctor must have mixed up the specimen. The lab mixed up the specimen. So in Singapore, I would vouch. Singapore usually very well regulated. It's really rare that this kind of major errors. So then sometimes I just have to be patient and gentle. Take a bit of time to absorb. Right? It's not immediately life-threatening, but I do need you to think through. And maybe the next time, come with a friend, come with your husband, come with your mom. Let's go through some of the facts again, and then we can talk more about treatment. Yeah, so that's another group. Then the last group, which I find the hardest to help, are women who perhaps, whether young or old, who have lack of knowledge about breast cancer. Yeah, which I was a bit surprised by. So 25 years ago, the internet wasn't so popular yet. There were people who have never heard of cancer, never had anyone with cancer in their lives. So if they had a breast lump, they assume that if it's non-painful, it should be okay, and they sort of let it be for a while. But in this day and age right now, I still have maybe almost 10% of the cancer patients coming in a very advanced, delayed stage, and they have different reasons for doing so. Similar misconception that if I have a lump and it's not painful, it shouldn't be anything serious. So here I would like to state for the record, pain alone by itself as a symptom is usually nothing alarming, but you should still get it checked, right? Just in case, right? The painless lumps can be so many different possibilities, but we should never assume. So even as a professional, we don't just touch the lump, right, and give a diagnosis.
Yeah.
We do scans, we do biopsies to verify what it is before we talk about treatments. So unfortunately, about 10% of women still come in with this really advanced tumor simply because of a lack of awareness and lack of knowledge.
I think there's so much to unpack here, right? Because so in terms of the kind of reactions that you have had to deal with as a doctor, it could be seen as, to some people, like a bearer of bad news, right? So you really have to be careful of how you relay that kind of information. So I think it's really impressive that maybe because of your experience as well, you're able to already sift out the telltale signs that, for this kind of patient, this is the kind of communication that I should relay to them, right?
Yes.
And I do also see this within our younger warriors, especially where they fall into group 1 in terms of their reactions. The moment they find out, they're like, okay, what next?
Yeah.
What can I do? I'm not thinking of the worst yet. Let's take this one day at a time. And I think I also have chatted with our guest from the first episode where, literally everyone has such different reactions, right? And feeling sad, being in denial, and all these are very valid emotions to have.
Yes.
So I think it's really, really commendable, like the kind of quick thinking that you have to apply to, because being a doctor is not just about the treatment side, right? It's also about the way you communicate and treat your patients. Yeah. Our guest from the previous one, she's a medical professional herself, and the way that she, reacts to reacted to her diagnosis would then be to, okay, this is something that I've studied before. How do I apply my medical knowledge? So it's really about identifying all of these different things. Okay, so in terms of the younger women, right, a lot of them are below screening age. Like what you said, you've had a patient who was 19 years old, and it's really, it's terrible, right? Like when someone as young as that who has barely started their trajectory on life is diagnosed with something so alarming. And usually with the younger patients, correct me if I'm wrong, it's usually the more aggressive forms of cancer, like TNBC and such, right? Okay, so for those who are below the screening age, what would then be like the best way for them to, find out that something is wrong, or even build that awareness about breast cancer? Because like you said, if you are not really social media savvy, which, we expect our younger people to be social media savvy, but
Nobody
nobody
wants to read bad news,
exactly.
isn't it?
It's
We'll be
usually
checking
for
out cosmetics and
exactly.
cat videos or something.
Yeah, exactly. So,
Yeah.
like how then would they be able to find out this information? What can they do and such, if you have any tips about it?
But I think what BCF is doing here is fantastic, because stories are really powerful, isn't it? Yeah. When there's a family history somewhere, you realize that everybody will sort of be aware, oh, Amma had breast cancer, y'all better check, y'all better check. And there's just that awareness. They may not know the facts, but it's okay, they know. Then if, let's say, within the office building, within a church community, frequently you find that, right, once someone has a diagnosis, everybody said, oh, I haven't checked. And then you all rush and see a doctor. So stories are important to raise that awareness. Then professionally, I think there's a few things I share. I always tell my patients who are in their, let's say, 30s and 40s, that they can teach their children, both boys and girls, how to do their own breast and chest examination from the time they've entered puberty. Why not? Especially for the girls, right? As the breasts grow and develop, there's a lot of natural, physiological, normal changes to expect, right? The swelling, the mild discomfort, maybe a bit of, dry skin here and there. So once you know you're normal, you're more confident in picking out the abnormal. So that's a monthly breast health check, a habit to start from age 18 all the way to 80. Okay. Second thing is, the reason why screening is through mammogram is because we can detect early cancers, isn't it? The calcium spots and all that. I hope BCF has covered that in another educational episode. Others can follow my Instagram to find out more. Okay, but it has a bit of radiation. So while it is safe, it's like background sunlight, or you take a flight, to America, it's the same dose of radiation. We try not to expose young ladies to it because, they make one children and you want the ovaries to get zapped, isn't it? So then what else is there? An ultrasound of the breast. So the caveat is that when you do an ultrasound on someone, almost everyone has one or two small little lumps inside.
Okay.
And the lumps can be called nodules, can be called cysts, can be called opacities. So all these are just very generic terms. Yeah. Then under that, we classify into cysts, fatty lumps, solid lumps, so on and so forth. So I tell my patients, when we do an ultrasound for you, expect to see something. And that's fine. The purpose is to do that regular follow-up, be it 6 monthly, once a year, or once every 2 years. The one that's growing faster than the rest, the one where the shape starts to look a bit weird, we intervene early. So I always, in a way, I guarantee my patients, if you see someone 6 monthly or yearly, you should never get stage 4 cancer, because we will catch it at an early stage, at stage 1 and stage 2, and treatments can be there, and you move on with your life. I think that's a fair promise to make. I hope.
Yeah. I think that's the thing, right? Like, some people still do not know that the earlier you catch, the more options there are for treatment, right? So a lot of people are, they're still scared, they're still nervous when something abnormal appears, and then they try to keep it, they try to, push it away. For the younger people, maybe they're still caught up in the rat race, like, hey, this is just like a little bit of thing. And especially when you said, like, if it's a painless lump, right? So maybe no pain means it should go away, like that kind of thing. But yeah, I think it's good that you've also shared with us like the different options, because a lot of people, when they think of breast cancer, it's immediately tagged to, okay, mammograms. But in terms of ultrasounds, what are the stages then, like, do you discover something abnormal and then you go to the clinic and then they refer you to get an ultrasound, or can you just immediately book an ultrasound, for instance?
Yeah, so 2 common ways for the young people to get themselves checked. I think breast self-check, you should start the habit. If you find something a bit weird, something you're not sure about, go and speak to a doctor. In fact, most GPs, your gynae may be able to help you. And then, of course, if you're very kiasi lah, then you come straight to see a breast specialist. That's fine. Okay. Then the other route would be, if you are having a regular health screening package, corporate health screening, why not? I understand more the packages, they have a certain option, isn't it? Like Haidilao, you can pick and choose what package you want. So then for ladies, I think, the best bet, choose an ultrasound breast. But keep in mind, you see, if you find nodules, don't panic. I think that's very important. Otherwise, you have a whole wave of anxiety.
Yeah, correct. Because I think, a lot of people think also that, a little bit of growth immediately, like the mind goes. And especially because, like what you said, with information being so accessible at your fingertips, literally just keying in all the symptoms and immediately it's like, the worst thing that could happen to you. And your mind sticks onto that, right? Yeah. But okay, so in terms of, for example, with breast self-examination then, I think there are still people out there who don't know what is the right way to do it, because it's something that you have to do at home alone, right? So who's going to tell me whether it's correct or not? So maybe if you could just share what is the real right way to do the BSE at home?
Wow, this is a bit hard to demonstrate and I'm a bit shy. I'm not going to be embarrassing. So again, you can check out my Instagram page, or better still, you look for my sister company, breastfriend.sg. So me and my partner, we've actually come up with a cream that's, because our logic, you see, women do our skincare every day or twice a day, right? Clean toe, moisturize, right? But we don't really look after the breast area. So this cream is a simple serum peptide cream, hypoallergenic, and it's based on the subscription model. So if you go to the website, you order it can be 1 try, 3-month or 12-month package, and then every month it gets mailed to you, physical thing.
Ooh.
So it's a small little packet and there's instructions within the package. Open it up and then you follow the steps. So we put it as 3 simple steps. Look, feel, move. Okay, I mean, look, move, feel. Look, move, feel. Okay, so for example, the first step is just, in the shower. You're already not wearing clothes. Look in the mirror and just see, right, what's the skin tone like? Is it a bit lopsided? Are there moles? Are there hairy parts? Right, and just take note of what you have. Or for ladies who had childbirth before, ladies who've lost weight, stretch marks and things, just observe it. And you'll be surprised how many people don't realize there were birthmarks somewhere. Right. Because when they see it, they go, what's this mole? There's a mole? They check, I never realized before. So just really scrutinize that chest area. Then during the moving part, it's just simply to raise your arms up and down. Because sometimes when there's a cancer, it's biting at the flesh, and you sort of see an indentation, a weird shadow appearing. So again, don't freak out, but just take note, how come this part a bit weird? Okay. Then after that, put the hands on the hips and press down and lean forward. So then the muscles sort of push the breast tissue in front. Again, any lumps that's eating into the flesh will cause a bit of a misshapen distortion. So these are all the small subtle signs to look out for. So look, move, and then you feel. By feeling, one hand up, use 2 or 3 fingers, the finger palm, not the tip, not the palm, and just sort of press around. So by touching, you don't just touch the surface. You have to do a purposeful press down, almost until you can feel your rib cage, and do a very purposeful rotation, like a massage. And I think the first time people feel themselves, they always tell me it's lumpy, and that is normal. Breast tissue itself has a very lumpy texture. And during your periods, it gets a bit fuller, a bit hardened. After a period, it softens. A real lump would feel like a little rock or marble, or like Play-Doh, kids Play-Doh, it gets a bit hardened and weird. So that kind of thickening is not normal. Okay, then what else do you feel for? Some people feel a hard lump somewhere in the center and they freak out. That's actually the ribs. So anytime you are, don't laugh, it happens more often than you think. So the first time, right, breast cancer awareness month, check, calling urgently, I feel a hard lump. And it's actually really just a rib cage.
Wow.
So hard lumps, just stay calm, check both sides. Things are symmetrical, usually it's okay. Then what else do we have? Any lumps that you feel, you should consult a doctor because the hands are not that reliable, isn't it? That's why we do our ultrasound and so forth to decide. Then the final step 4, is squeeze. Squeeze is a bit odd. You have the nipple, and then you sort of go just behind to the areola. I think women who had breastfeeding before, they will understand. Yeah, you sort of squeeze it purposefully, U shape and C shape, and give it just enough of a discomfort. The purpose is to elicit any nipple discharge. So one or two drops, clear color, transparent, milky fluid tends to be okay, hormonal. The alarming colors may be, let's say, dark brown, reddish maroon, rusty color, or fresh blood. Then again, don't jump to conclusion. Not everything is a cancer, but then you should be seeing a doctor. So again, the steps, right? Look, move, feel, and squeeze.
Wow. That was so insightful.
Good.
I feel like I've seen all these, BSE guides, and nothing was as in-depth as this. So I think one of our breast molds that we use during our awareness talks as well, right? It also mentions kind of like a stringy texture. Is that something that also might present itself and turns out to be cancer?
Yes, definitely. So if you know, internationally, there's this campaign called Know Your Lemons campaign. And I think, is it BCA? There's a pineapple tart campaign, is it? Or is it Singapore Cancer Society? It's really cute.
Ours is going to be mochi.
Mochi! That's true. Mochi has that soft squish. Yeah. So I think it's just having that awareness of what's normal and what's not, isn't it? So people use fruit as a common analogy because, in the farmland, women with no access to education, you harvest fruits all the time. So when it's a bit rotting, there's early rot, it's not as fresh, they touch it, they know it. So that analogy is in our breast as well, right? So many symptoms overlap. This goes down to the breast structure, right? The breast is formed of multiple lobules. So imagine like bunches of grapes everywhere. So each bunch of grape will swell up and subside. So people assume that cancer grows as a lump. Sometimes it doesn't. The inner lining of the milk duct gets a little bit irritated and forms like a thin layer of cancer. And sometimes it bursts out and forms a lump. So that's an invasive cancer type. But sometimes it tracks along the inner lining. So imagine the milk ducts as a tree branch or bunch of grapes. That cancer sort of spreads down the entire tract. That's why by touch, you don't actually feel a distinct hard lump. You feel generalized hardening or the weird string. Yeah. So that's one explanation. So I always trust the lady's assessment. If she's been doing her regular monthly breast self-check, she can swear to me this thing is new, it's different. Then even with the ultrasound can't see a lump, we have to respect that there's a new change. Then it's our job to figure out, how do we biopsy the area? Do I do an MRI first? Do I do a random biopsy? Do I do a minor surgery open biopsy to make sure she doesn't have cancer? So these are maybe things that a breast specialist can help better with. This is not so commonly taught, and this comes from more experience as we see the unusual types or unusual manifestations of cancers.
Wow, that's really interesting. And I think that is really why breast self-examination is so important, the knowing you're normal.
Yes.
I think we did speak about this previously as well, where, like different women, the texture of the breast is completely different, right? So you kind of need to collect that historical data in order for you to know that, okay, hey, this is when, I really need to go and get it checked, right?
I got a different story for you. This is in the older lady now who found a hard breast lump. Or rather, she saw me for hard breast lump, really rock hard, and it looks very badly deformed. Then I'll be like, when did this happen? 30 years ago. I'd be, 30 years? Okay, then tell me more. Have you had any procedures done? Then she looked at the husband, she looked at me, and she asked the husband, wait outside. Okay. I injected before. I said, inject what? So in those days, there are some aesthetics procedure where it's not by a doctor, it's an aesthetician to inject random silicone into the breast. And her case went badly.
Oh, no.
Yeah, there was an infection, and that's why the whole breast became very scarred up. There's nipple retraction, there's hyperpigmentation, it looks very dark, and now that silicone became a bad hard scar.
Oh, no.
So I touched her and I told her, ma'am, at 60 years old, I respect your story, the silicone, but with hard lump, I cannot not do a biopsy. Let's get you mammogram, ultrasound, and so on and so forth. And with silicone, it's unusual. It sort of blocks off the radioactive rays. So it's just one big block. And ultrasound is like invisible. We don't see anything. So I told her, I'm sorry, ma'am. I have to do by hand, feel the lump and do a biopsy. So she understood. Thanks again to Breast Cancer Awareness Campaign. She is aware it could be breast cancer, but she's been assuming that for 30 years it's okay. So I told her, you are right. If 30 years you never change, you're still alive, it cannot be cancer. But I have a professional reputation to maintain, I must check. So we biopsy it, and true enough, it's something called silicone scar tissue. Yeah. So you see, knowing the history is important.
Yeah.
So for this lady to be forthcoming, just shy in front of the husband lah, but to tell me that it's been there for 30 years, about the same, just that recently I heard about this breast cancer, I think I better check. And that's fantastic. We have complete proof it's non-cancer, we have peace of mind, and we get to move on, right, without worrying about this lump.
Yeah. And I think that's exactly why awareness efforts are so important, especially for causes like this, right? Because I think breast health in itself is already, it can be considered a taboo topic for some people still, right? Like, because it's a private area.
Yes.
So people don't really want to talk about it. A lot of them like try to hide it if anything happens. So it's really important for the word to get out there to the public in order for them to know that, hey, actually, these are the things to look out for. These are the places that I can go for help to, so it's very, very important to normalize this kind of conversations about breast health, I would say. Okay, so from your experience as a breast surgeon, right, what are some of the most common misconceptions about breast cancer risk?
Wow. I also don't know when to start, man. But why don't you share a few that you heard before first?
Wow,
that's a lot.
Okay, so the things that I know that are
Yeah.
pertinent for young women,
Yeah.
aside from, it's a older woman's disease, there are people who think that, if I am single, I can't get breast cancer. If I'm pregnant, I can't get breast cancer. If I'm breastfeeding, I can't get breast cancer.
Oh, okay.
Yeah, so there are people who think that, at these different stages, breast cancer is not even a thing to think about, right? But what I find out from, some of our younger warriors, some of them, during the breastfeeding stage itself, in the early stages of their pregnancy, that's when they notice something going on.
Wow. Okay, this is insightful because you know why? The women who are concerned would have seen me. The women who don't know, don't care, and thankfully healthy, they would never come across me. And that's why I never get to hear that aspect of common misconception. What I see are the ladies in the mild denial. Yeah, so you're absolutely right. The woman who, let's say, we diagnose a cancer, then she'll be in shock, and then she'll say, no, cannot be. I'm vegetarian, I exercise a lot, I do yoga, I have 4 children, I breastfeed each one 1 year. So they use this as little like young scientist award. I achieve all these things, therefore I cannot have breast cancer. So that's why we have to again soften the impact. It's not something that you did or didn't do that triggered the cancer. Cancer as an illness, I try to reassure them it's not how should I put it? It's not something we did intentionally. The cancer process at a single cell level is something very natural. And a very simplistic way to look at it is that every cell has a certain programming in place. A cell must also live, grow old, and die. It has a programmed cell death. But when the cell's programming goes haywire, that's when it becomes a zombie and mutate. And to carry the analogy further, zombie got different type, right? Got the slow type and got the train to Busan type. So likewise, cancer got the slow growing type and the fast type. So when I say it this way, they feel a lot more reassured. Right? Cancer cells may actually happen in any of us at any time. But our immune system, various factors will recognize it and suppress it. So a lot of things must line up for that cancer to grow and take root, if that makes sense. So of all the, dozens of risk factors we talk about, age, I feel, is the number one thing we cannot escape from. The older we get, the more likely we develop cancer somewhere. Second thing would be maybe things like inflammation. Again, very broad thing. Inflammation can be so many things. The food we eat, the air we breathe, the stress levels we have, generalized obesity. There's just so many things. Alcohol, smoking. So all these lifestyle risks sort of build up. That's why, when people counteract, my uncle is a smoker, but he lived until 95. I say, maybe his other things are so good, it counteracted his smoking risk. Then likewise, someone who's, tick all the checkbox for protective things, may still have a cancer, maybe from unknown genetic cause, maybe due to other stresses that we haven't identified. So that's why I think we control what we can. Right, exercise eat healthy diet, maintain slim weight. So you lower your risk. But never assume that it's impossible. Like the Singapore SPF slogan, right? Low crime doesn't mean no crime.
Actually, that's something that we included in our BCAM video this year as well. Like a lot of us think that youth protects us, success protects us, health protects us. But that is not to say that, no, you don't take care or think about all this. You still have to do the necessary steps. But at the end of the day, when something does happen, I know it's very emotionally challenging to, process and really calibrate yourself from a diagnosis as big as that. But I think as best as possible, we try to encourage our warriors to not feel guilty about it, to not blame themselves.
Definitely.
Yeah, and even like a story shared from the previous episode where, because she was a young survivor, so people were also telling her that, how can it be that you got this? This is something for older women, So it's a very difficult experience to have to go through, right? And we can all do without that guilt and the blame. It's really about what can we do next? How can we take better care of ourselves and how to get through it? Okay, so just now when we were talking about the BSE, right, I wanted to ask a question actually about the frequency of the BSE and when is the right time for us to actually do BSE. So we kind of know that, okay, once a month we should do it, but is there like a right time for us to do it?
Ideally, I think, if someone is still having a period, if you can time it so nicely, wait until a few days after the period is over. The reason is because during the period, most ladies have a little bit of swelling and discomfort, right? Because the breasts are not sure whether we're going to get pregnant or not, ma. So it's getting ready to receive a baby and produce milk. That's why it's very full and weird feeling. Then after the bleeding comes, okay, fine, not pregnant, okay lah. Then rest. Yeah, something like that. So that's actually the best time to feel. So I always tell patients, if you feel a hardening or hard lump, don't panic, but just observe 1 or 2 weeks later. Minor hormonal changes. If you think back, if you take a flight somewhere, you ate a bit too much water retention, you didn't sleep well, weird aches and pains are over. So just take note of that and then follow up in about 1 week. If it's persistent, then of course you check the doctor. If it's gone, then it's gone. Leave it be. Yeah, so that's for the ladies who are still having a regular period. Then number 2, if not, for ladies, who had contraceptives, who have already entered menopause, or women with irregular periods, you just can't tell.
PCOS,
then never mind. Just make sure you choose a date once a month and just do it. So even if you forget and it's not like once a month, like once every 2 months, it's still better than nothing.
Plus the anxiety, right? Like the moment you see, hey, is this different or not compared to the last month and things like that, right? So there's all this information that we kind of have to digest and really, find a way to put into our self-care routine.
Yes.
Because at the end of the day, this is part of the self-care routine,
This is
right?
why I pitch my breast cream again.
Yeah.
It's literally called once a month.
Oh, it's called once
It's called once a month. So if you
That's
Google
great.
once a month breast friend serum, you should find it. You should find it. And just no application, but just look through it.
Yeah.
So
And something that helps you with the routine,
yes.
right?
That's skincare routine, right?
Yeah.
We do it every day, twice a day. And we touch up the makeup, we apply sunscreen. I know where the pimple, I know where all my freckles are. But we don't check this part. Yeah.
Okay, so then let's talk about your Instagram account, right? Because you are one of the doctors that I think is really active on social media.
Yay.
Yeah.
But I don't do comedic skits, leh. So few followers. Hint.
Okay, so how did this start? Like, what actually inspired you to start this social media page?
Okay, I'm 45, but in my heart, I'm 25. So I think honestly, when we're in restructured hospitals, there's almost a professional burden. Because if you are employed by XXX hospital, whatever you say can be reflective on the hospital. So I feel there's a lot of things I want to tell the world about, but I can't. Yeah. So at the time I left for private sector, it was for multiple reasons. I can do it as an education, I can do it for outreach, I can do it as a personal self-journal page, and of course on the selfish note is to build my practice, build my branding, isn't it? Then I think in case the audience is not aware, for medical doctors, we have very strict guidelines on how we portray ourselves in public media. I cannot tell, I am Singapore's #1 breast surgeon. There's no such thing, right? Or I'm very highly experienced. So we cannot use self-praise words. So then I decided, okay lah, definitely education is the way to go. But education, again, tends to be very dry, isn't it? Yeah, the breast is comprised of 20 lobules. Nobody wants to hear that.
And the medical jargon and all that.
Yeah. So then it became a lot of research, right, into what other doctors do. Then something really funny, right, the comedic skits. Then I was thinking, can I do that? I would like to, but I feel it's a bit disrespectful for patients going through cancer. So I have taught a few little skits. And I'm trying to bounce that off my own patients to make sure it's something that echo with them before I eventually film them one day lah. So subscribe. Yeah. So in time, I think we started. If you really follow, and I don't know how your young people use Instagram lah, but I really am quite proud that I left a chronicle of different things. So the initial post was a bit random, chronicling like my life and stuff. Then I wanted to be a little bit more targeted. So I separated into 2 accounts. Breast Friend is especially for the clinical side, and Long Mama is for my social side. So my husband's surname is Long, and I'm a mother of Longs, right? So Long Mama. And it's fun because it's like some gangster,
like a reference.
That's right. So there's Long Mama. So that's where I talk about my fun stuff lah, all the food and drinks and stuff. Then on this page, I refine it a little bit more. So we share about facts of cancer, common myths, a bit of reflection on how to stay healthy. So exercise tips, food tips, things like that. So over time, I kept trying to refine it and share different things about breast care. The most recent thing I'm very proud of is that throughout October, I did a daily post. And each post is a simplified version of each of my cancer patients to chronicle cancer survivors. Yep, for a wide range of age groups and different conditions, DCIS all the way to stage 4 cancers, but all of them have been successfully treated. They are now at least 2 to 6 years in remission.
Wow, I think that's great because, aside from just sharing about the actual condition itself, right? I think personal stories like this, they are very, very inspiring. And it also lends to that motive, right? That you want to get less people to be afraid of coming forward. So the more options they see, more examples of people who survived cancer, they are living through their daily lives and exploring new things. I think that brings about a certain kind of hope as well.
Yes.
So I really think that's wonderful. And it also shows how, as a doctor, how you have really put your mind into changing the way you educate the public about this, right? And, like what I was just saying about the fear and the stigma and things like that, how do you then make that decision of, that balancing act within your content of, okay, it must be educational, it must also be sensitive, like what you said, to your patients, but still make it relatable such that people from the public, they don't just watch and then they kind of like, get bored by it.
Maybe they are bored, Lee. That's why I got so many followers. Yeah,
I don't think so.
Because I think so quite interesting. The people who follow will really follow, and they will send me private DMs. Is it? They do comments here and there, and some of them identified themselves. That was, oh no! I really tried to anonymize it, but they recognize themselves. Yeah, so that was really amazing. Yeah. Then I guess what I always tell patients is when you go to social media and you type breast cancer, the influencers that come up, I would say, come in 1 or 2 categories. One tend to be patients with bad outcomes, not training for of their own, but patients who have failed conventional treatment. You understand the phrase, right? So the first line chemo didn't work, their second line, third line, they are dealing with metastatic cancer, and there's so much a process. And for them, they want to reach out and educate the public. But that kind of messaging affected the average well person a bit fearfully. What if I end up like her with stage 4 cancer? And I tell my patients that's actually the rarer group. The majority are early stage patients who actually, are treated and are in remission. A second group of influencer might be those who take a lot of pride in the fact they're cancer survivors, and that is not wrong. But all their posts are all about the cancer treatment and so on and so forth, without talking about life after cancer. So interestingly, for some of my patients, they said that they would read it, they felt a bit alarmed as well. You mean forever? I'm forever a cancer survivor? Can't I go back to be my old self? I say, yeah, it's really your personal choice. And for myself, I've decided if I ever have cancer, I hope to normalize it. It's just an illness, just like any other. Once the treatment is over, I want to put it behind me. When you think about a lot of other medical conditions, I don't see people labeling themselves as, I'm a type 1 diabetic. It's not one of the first few labels that they use, even though it's a lifelong condition as well. Or let's say someone who had an amputation, people look at it and can see that loss of limb, but they don't identify, no, I am so and so and an amputee. Seldom. They actually go on to talk about themselves. moving on
as a
after
human
that.
being.
Yes. So I'm hoping to normalize this aspect of breast cancer as well, right? Whichever helps you to feel happy and confident about yourself, right? Go ahead with it. And if let's say you feel a calling to be a breast cancer advocate, that's great, right? We need people like you to be brave and speak up. And if you want to put it behind you and move on, yes,
Yeah,
that's
that's
also
fine
great.
too.
Yes. Yeah.
Yeah. Have you ever wondered, like, why did breast cancer survivor become such a, like, mainstay type of terminology? Then is it like something related to the shared experience, like, some kind of identity bonding type
Yeah,
of?
you're right. The breast cancer community seems to be a lot more vocal compared to other women's cancer, right? Endometrial cancer, ovarian, cervical.
Cervical, yeah.
Yeah. Maybe, okay, factually, breast cancer is the most common cancer, isn't it? And thankfully, also, we have such good treatments. A lot of patients live on past that. The 2-year, 5-year, 10-year, 20-year, even people who are remission until the end of their days. So that community is, that sheer accumulation for
Yeah.
survivors to build up. And the other thing is, you see, a lot of women, in fact, all of us, we are not alone. Once someone is affected with cancer, our spouse, our kids, our friends, our whole community is affected.
Valley, yeah.
Yeah. And it's so common, 1 in 10, 1 in 12 women will get cancer in our lifetime. So once you open up a story and mention, I've just got diagnosed, someone somewhere say, oh, shucks, man, my wife also. And then somebody else, oh yeah, my mom had it. And then suddenly you're like, oh wow, people have been through that grieving process together. And in a good kind of a support, people will share little bits of story. Yeah, the chemo was really bad. It was really, really bad. But then what we did now, the sour Sichuan sour soup worked for her. And then, did it work? So that kind of community spirit really help each other to go through the difficult times. Then years later, you see, should anyone have a relapse, you find the community bands together again. So, oh no, do you hear? So and so after 10 years, now stage 4. And then there's this collective grieving again. And then there's this little, oh no, shucks, man, what if it happens to me? And then they will come and check with the doctors, we give them some advice, and if they're fine, I encourage them, okay, what's happening to others is others. That's right. Right. Believe in yourself, believe in the signs, right? Just stay calm, continue your management. If it comes, it comes. If it doesn't, don't take on that negative experience. Yeah. So breast cancer community, I think it's still good lah. We should be talking about these. If anything, the male cancers, maybe men don't talk about their suffering as much. Yeah, some of my patients are very cute. Like, it comes as a couple, right? Husband and wife. And the wife will be very sad at having to remove one breast. And the man will be very blessing.
Yeah.
Why? The children big already, just remove law. Then be, sir. If you have to remove one of your private part, how you feel? Then it maybe you cross their legs.
Yeah, because it's hard for them to make that connection, right?
I say, you see, you forget that for most women, the breasts are the very visible part of our womanhood. The hair as well.
Yeah.
Like right now I have short hair. If I'm completely flat chested and the deeper my voice, you may think I'm a man. So how we identify as a woman is related to how much we value these outer appearances.
correct.
And that should be validated. So whenever women see me and they are a bit confused, should I get mastectomy or a partial lumpectomy or recon? I say, actually, it is your decision. Let me show you the pictures and you see your visceral reaction to it. And some women take one look at mastectomy and they, like cannot. This is an alien, this is discriminating, this is horrible. I said, okay, then forget it. This is out of the question. Let's work with the other two. Whereas some women, oddly, they look at it and they be like, oh, okay, leh, very good, leh. So no need to wear bra, right? So interestingly, their mind has accepted it.
Yes.
To them, it's not a deformity, it's great. I don't have to worry about mammogram ever again. In fact, the other side can take off or not. So it's so personal. Yeah. So that's why I would like to encourage and normalize this kind of breast talk.
Yeah, exactly. I think our guest from the first episode as well, she is an artist who just did an exhibition, which was a photography exhibition post her mastectomy.
Yes, I've heard about it. One of our mutual friends she sent me the link. I just couldn't find time to go still. Yeah.
But that was great because
Yeah.
for her journey, the moment she knew that she had breast cancer, her mind immediately was like,
Yes.
let's remove both. It still affected her though, like the first look and everything, right? Like, because you have been growing up with that
Yes.
same body for a very long time. So, even if before you were okay with that decision, when it actually appears in front of you, you might, be a little bit startled. You might grieve your body a little
Yes.
bit and things like that. These are all completely normal. But after that, she also found the joys in the little moments. Oh, now I no need to wear bra. I can go grab my food from the delivery rider without, thinking so much, like that kind of thing. So yeah, truly everybody's experiences are different, and you really kind of have to tailor that conversation
I had
accordingly.
one unusual patient. She's from a different country, so English is not her first language. So she's seeing me for some breast condition for one side, and we did minor surgery. She's okay. A few years later, she developed a different tumor on the other side. Then, as we talk, suddenly she started to ask questions about top surgery as a transgender. Then I was like, maybe the language is wrong.
Like, where is this going?
Yes. So I had to show a lot of pictures, and it was I had to do a quick revision of the correct terminology to use. So, are you a woman who loves women? Then it was very cute. She looked at me like, like you're stupid. Like this woman with me has to come in every year with me, and then she started to like that. I'd be okay, okay, yeah. Then after that, show pictures, so on and so forth, implications, yeah. So I took a bit of time to make sure I really understand her first, and to see how much she wanted to go down the sex change journey. So in her country, she was sharing that it's not so taboo to do a sex change and to be gay. The second unusual thing is that she stopped short of wanting to do a reconstruction at the genital area. Yeah, then we proceeded with the double mastectomy, preserving her nipples and try to shape the scar so it looks like it's the top surgery.
Beautiful.
Yeah, but in removing the tumor at the same time. And after she woke up, she was crying. So I was very scared. Oh no, did I
you do something
misunderstand
wrong?
and all that? So it was not. Again, through language and gestures, she was grieving the loss of her female self and just saying goodbye to her. I was very touched and amazed to see this, to help someone through her cancer treatment, and also to help her
fulfill,
find her identity.
herself.
And it felt like a very unusual journey because in Singapore, it's still a very tricky topic, and trying to get the right help through the correct team of people is a little bit difficult. Private sector is a bit easier. We can quickly ask around, see which doctors are able to assist, and then we just get the necessary treatments on. Yeah, so that was one of the more meaningful, unusual patients I've helped.
Yeah, I bet. I mean, that sounds, wow, that's such a deep story.
Yeah.
The fact that, she came in a way, it was like killing two birds with one stone, right? Like, she was able to, like, she got rid of something that was, unhealthy for her.
Yes.
In one way, and also managed to find herself again.
Yeah.
Right? That's honestly a very miraculous journey.
Yeah.
Yeah. Okay. In the kind of, like in this stories that really stuck with you type of topic, right? Was there any particular story that about courage and hope from your patients that you would really like to share with our audience?
Wow. The one that definitely comes to mind is this lady called Joanna. Yeah, her story is out in the public domain. She's given an interview to the Straits Times. Yeah, so in brief, I think she was 30 or 31 when she first saw me for a medium-sized breast lump. So then biopsy, staging scan, she was stage 4 at the time of presentation. So we were still hopeful, isn't it? Because young, we will do our best, definitely. So recommended her to the oncologist, and she was single, no partner, no kids yet. So I told her go and see a fertility expert just to discuss fertility preservation. Then after she spoke to both of them, she called me back and asked me, the oncologist wants her to start chemo ASAP. The fertility doctor wants her to harvest the eggs next day. But if she harvests the eggs, then it will delay her chemo by a bit of 1 or 2 weeks because of the menstrual cycle and the hormonal imbalance. So her parents want her to do chemo ASAP. She's thinking about getting the eggs, but what do I think? So then I told her, wow, now I'm not talking to you as a doctor, I'm talking to you as a big sister. Right now you have nothing to lose. You have stage 4 cancer. Without treatment, you'll perish from the tumor. So in giving yourself the best chance, I would like to give you hope. bite the bullet, go and harvest your eggs.
Mm.
Right? So that at the end of that 1 year when you're cancer free, at second year, if you find someone, you can move on and have children of your own. Right? That's one option. Yeah. And if let's say the treatment doesn't work, you have done yourself the best, right? Giving yourself the best chance. Yeah, so she went ahead. Then her whole story is chronicled in a book that she wrote, but her treatment was very rocky. She developed a major stroke. She suffered a love scam. Yeah.
Oh.
Yeah. But at the end of that whole journey, she came back to me and she underwent surgery and she was cancer free, right? Near complete remission, just a tiny trace of abnormal cells left. So yeah, Joanna. Yeah, that's one of the most amazing stories I've had. And credit not to our medical expertise, but credit to her parents who came with her for almost every appointment. Very lovely, down-to-earth people who were just so warm and accepting. Even when, all the adverse events happen, at no point did they blame the medical team. It's because of your medicine that caused a stroke. They just, okay, these things happen. We just have to move on. Then the mom was flustered, right? What can I do? What can I do? And I thought, okay, don't worry. Leave the medical things to us. What you do is to look after nutrition. So she committed herself to cooking good food for her. Yeah, her sister, her best friend, shaved their hair off to support her through the chemo sessions. And I tell you, it's credit to all these support that the patient has to help them through the hardest moments. You know what I mean? The medical team only sees them at fixed interval. And at home, when you're alone, when you're half asleep and the world feels bleak and empty, I think the community, the family, friends are what keeps you going. A text to someone to talk to. Yeah. So to everyone, right, listening now, I think reach out. Right? Don't be scared of triggering them. I don't think it's triggering. Just like, hey, I heard you were diagnosed with cancer. Yeah, how's it going? Yeah, I want to catch up for coffee someday. They are still normal people, okay? So please treat them like normal. Once you start to be a bit afraid, like, if I ask her why you should cry, then that's doing them a disservice, isn't it? Yeah, still be a friend, still hang out and do normal friend stuff, and they will appreciate you the more for it. In a way, it's like, look beyond their cancer labor.
Correct.
Right? If you are best friends, you all used to go whatever, rollerblading together, ice skating together, there's nothing stopping them from doing these things again. Maybe just a bit weaker, a bit slower. There are certain days they can do it, certain days they can't. Yeah, just invite them out. I think that's fine.
Yeah, and in fact, those are the things that help them find the motivation, right, to get better as well. Because at the end of the day, they are still the same person. It's not like they, magically with the cancer diagnosis become someone completely different, right?
Exactly.
At their core, it's still the same person.
Exactly.
Their interests are still the same.
Exactly.
The way they view things are still the same. And I think a lot of people maybe are uncomfortable at the show of emotions or things like that, like, oh, what if, like what you said, right? Like, what if this person cry? What do I do? What do I say? But think about it as simply, okay, if before the cancer diagnosis your friend was crying, what would you do?
Exactly.
How would you talk to that person, right? It's exactly the same. And I agree. Community support, support from your loved ones, from your friends, these are extremely important factors, especially for breast cancer warriors to know that, they are not alone. Actually, with any kind of sickness, it's really like that. And as a doctor, right, how do you then compartmentalize, your emotions? There's probably a lot of heaviness from different patients. I'm not saying that all of them react the same way, but how do you then, like when you come back to your own family, how do you separate that?
Wow. All these professional empathy, I think we learned along the way. I think we entered medical school at age 19. We graduated at 24. And, overnight you become a doctor. And, your first cold blue resuscitation, if the person die, So I think all doctors have their own tragic story to tell, really like K-drama one.
On Grey's Anatomy.
Yeah, that's right. So those who actually are so affected, you will notice that some of your friends might have dropped out along the way. Or they drift into medical fields where they don't have to interact with people anymore. And I don't think it's that they don't care, but the caring hurts them so much, they know how to figure it out. Yeah. Then for those of us who learned, is through same thing, peer support, talking to seniors who've been through it. And I think the good thing will help us to differentiate, right? The person's death was not your fault, right? The condition is bad. It will have happened regardless what you did. You've already done your best. Now learn from it and move on to help the next person. Then if let's say there was a medical error based, from what we did, internally we have our own, a department reprimand,
Like
more
the own
official one, suspension, and
guidelines.
so on and so forth. And then once you pay the due diligence, ideally this person still return to practice, learn from the mistake and move on. Think of the potential other future lives you can save. So right now, after 20 plus years, right, I think I hope that all doctors never lose the heart to care, because it's what makes us so passionate and so driven. The selfishness is learn when to distance it. So sometimes I joke my patient, I am breast friend surgery, but I'm not really your friend. Your emotional support, go and find your real friend. Which is sort of true, you
And
know what I
you
mean?
kind of have to do that, right?
Yes.
You have to draw that boundary,
Yes.
you know.
Because some of them I've noticed they are single or very private people, and they come year on year alone. And after a while, they are trying their luck. They will start to ask me out for coffee, ask me out for drinks. These are fellow ladies, and I don't think they're gay. It's just they're lonely. And then they'll start to, let's say, reach out on Instagram and try to be very personal.
They
And
probably also created like a level of trust with
yes,
you, right?
Yes. So I have to recognize that and not build up that dependent relationship. It's not professional. So yes, I'm here for you as a medical doctor. I should not also be your best friend. There's a conflict of interest. Then let's say I do have close friends who see me for medical conditions. So before I accept them as patient, I also told them clearly, when you're in the clinic with me, it's a doctor-patient relationship, right? Outside, we are still friends, but I will never discuss your medical thing with friends. Friends are friends, but when we're inside here, whatever you tell me is confidential, is a doctor's notes. So I think, drawing boundaries, having my own friends to talk to, friends who are medical as well as non-medical to help me see the human aspect of things. And still when need to must cry. I think so. One of my good friends' niece saw me. This is a colleague and a good friend, and we are the same age. The niece is I think the oldest cousin's youngest girl, something like that.
Okay.
So quite shockingly, stage 4 at a presentation. And unfortunately, during the chemo, she passed away. And I didn't know. So what happened was I saw her, did the biopsy, sent for chemo, hoping, in 3 or 6 months she'll come back and we can talk about some other treatment. Then the next thing I knew is I met the family in one of the hospital's corridors. Hey, how come you're all here? And so, she's inside the ICU and she's dying. So I stepped in, and then I burst into tears. Then it was so I felt a bit ashamed because the mother had to comfort me. Aiyo, I tell
That's
you.
the empathy.
Yeah, I think just a bit too shocking because most of my patients really, they do well. The early stage patient, even my stage 4 patients who recover, and that's my optimism. Yeah, and maybe selfishly, you see, I never became an oncologist. Those are the chemo doctors, because the chemo doctors actually deal with some of the very challenging cases. Yeah, then there's also palliative doctors who look after patients with terminal
That
cancers.
must be so difficult.
Yeah, their hearts are amazing. Yeah. So I have a friend who's a palliative care doctor, and then she said, after a while, you also develop this very professional selfishness. You care, but there's a barrier, there's a mask that, because she said, really, every patient that they meet will die within 2 to 4 weeks. That's like, wow, I cannot.
Yeah, that's really tough.
Yeah.
I cannot also.
Yeah, but for her, she said it's a necessary job and she has to train for it. So they strike out a very professional, caring relationship to support the family and all that. And in their mind, they have a very clear timeline. At this stage, the breathing becomes worse and so on and so forth. They will succumb to death within the next few days. And it's a very fixed timeline they give to the family, and they support the family during that. And the family is appreciative, because I think when disasters happen, the doctor cannot break down and cry. The doctor has to stay strong and guide the patient and the family through that disaster, through that crisis.
Exactly.
So, yeah.
And I think it's so true. Like, when you need to cry, you just have to cry as well.
Yeah.
Doctors are humans too, right?
Yeah.
Like, I mean, okay, maybe don't break down in front of your
Yes.
own patients' families. But at the end of the day,
Yeah.
you need that space too. Because, all that feelings that's bubbling up, it's a lot. It's a lot to handle, right? Okay. All right, so I think we've reached our final question. And just how you have been explaining to your audience on your social media account, right? in that very simple, friendly, very warm, sisterly tone type of language, right? If you were to explain to your daughter, for instance, or a sister, for example, in like 1-2 lines about breast health, right, and taking care of their breast health, how would you tell them?
Yeah. So I always tell them, right, cut it down to 3 simple take-home messages. One is do your monthly breast health check once a month, know you're normal. Number 2 is good to see a doctor once a year and discuss what kind of imaging is good, right? Mammograms, ultrasound. And the third thing is if you pick up something abnormal, don't panic, don't Google, don't self-diagnose on ChatGPT, and see a real doctor.
Wonderful. Yeah, I think these are like really, this sums our conversation up, right? Yeah, okay. Well, and with that, we have actually come to the end of our third episode. If you would like to find out more about how to do your BSE at home, we have an animated step-by-step guide available right here on our YouTube channel. And it's also up on our Instagram at bcf.sg. At BCFSG. And of course, if you'd like to hear more from our wonderful Dr. Tan over here, do give her a follow on Instagram at Breast Friends Surgery. Remember, early detection saves lives. Breast cancer doesn't care, but you must. Check your breast. It's for the best. Don't forget to like, subscribe, and share the episode if it's up to your liking. And see you on the next episode of No Age Limit. Bye.